It's no secret that firefighting is a dangerous job where firefighters put their lives on the line to save others. But often it's not the flames or a falling roof that might claim a firefighter's life. A 2007 Harvard study shows that firefighters are 100 times more likely to suffer a fatal on-the-job heart attack than other workers. In tonight's report, NJN News health and medical correspondent Sarah Lee Kessler revisits a Patterson radiologist who's leading a campaign to take a life-saving look inside firefighters' arteries.
You guys are at a tremendous risk, way above the general population when you're fighting a fire to die suddenly.
It's been 2 years since we introduced you to Dr. Frank Yupa, a St. Joseph's radiologist who visits New Jersey firehouses, warning that when the fire alarm goes off, the risk goes up dramatically.
Their adrenaline levels are up, they're inhaling noxious fumes. The heart attack rate amongst firefighters is 100 times greater than the average person.
Dr. Yupa tells firefighters that all that stress takes a toll on the most important muscle in the body, the heart.
Here, look at this picture. All that white stuff is plaque on that person's coronary arteries.
You don't want that nastiness in your body. You want to be healthy.
That's why Linden firefighter Chris Lukenda is taking Dr. Yupa's advice to get a CT scan of his heart to see what's going on inside his arteries. Chris, who's 44, has reason to be concerned.
My father he was a firefighter for 34 years. He had 3 heart attacks over the course of his lifetime.
A calcium scoring test, like the one Chris is undergoing, measures plaque buildup inside the arteries.
Our preliminary data after studying close to 1,000 firefighters over the past 24 months with calcium scoring is that 42% have coronary disease. You got some early soft plaque. You can't change your gene pool, but you can alter it by intervening early.
If I want to live, I'm going to have to make some lifestyle changes. It's as simple as that.
The calcium scoring test costs $250, but is offered at a $100 discount to firefighters and other first responders. But this procedure is not without its critics, some of whom claim that the radiation you get from a CT scan is equivalent to about 100 X-rays.
The radiation dose now with new software is equivalent to living in New York City for 8 months out of the year.
Dr. Yupa recommends a calcium scoring test for all firefighters ages 40 and up, age 35, if they have a family history of heart disease. Sarah Lee Kessler, NJN News, Clifton.